short stature, which can mean that if we think back on that growth chart that we were looking at, even if your weight gain is nicely tracking along your curve, if your height isn't tracking at that same velocity, your BMI, the body mass index, comparing your weight to your height, is going to be increasing. And again, BMI isn't necessarily a fair indicator of nutrition status for people with DMD, but it is one measure that your team is likely to be tracking. And then I want to touch on the impact of steroids or other medications, which can really make for a perfect storm of nutrition challenges. Likely, we're seeing some decreases in physical ability, leading to less energy expenditure, while at the same time increasing appetite and caloric intake, which is really hard. And I think that's particularly hard because culturally, food is really important to us. We share food to mark important occasions and accomplishments, and we share food to show love and to connect with one another. And as someone who derives a great deal of joy from preparing and sharing food, I know that this isn't easy, and these can be really hard conversations to navigate. And steroids also impact bone health, so now is a good time to assess intake of calcium and vitamin D to make sure we're on track. And you may be on other medications with side effects or have other health conditions that can impact your nutrition status as well. Another point that I wanted to touch on is just that nutrition issues for people with DMD are likely to change quite significantly over time. And what I mean by that is that usually when I first meet a family with a child with DMD, we start out by talking about the factors that can contribute to weight gain. But with increasing muscle weakness can come difficulties with chewing and swallowing. So this could mean difficulty managing liquids specifically, or feeling like food's getting stuck in your throat. It can also mean that it just takes more time and effort to chew. So a meal can just take that much longer to finish. And we all only have so many hours in the day. So if eating enough to maintain your nutrition starts taking up too much time, that's going to be a real problem and a real challenge. Which is where I want to take another opportunity to highlight an important team member, which is either our OT or occupational therapist, or SLP, speech language pathologist, who can help with evaluating chewing and swallowing and providing strategies to help ensure safety and efficiency. I also want to say that at some point it might be valuable to have an alternate route for nutrition, such as a G-tube or a gastric tube, which is a tube that's placed into the stomach through which food or formula can be given directly into the stomach. And oftentimes I hear G-tubes being referred to as a worst case scenario or the last resort. And I really feel strongly that we need to change how we talk about G-tubes to make it a more positive conversation. Having a G-tube doesn't necessarily mean that you can no longer continue to eat by mouth, but it can be a really supportive alternative, especially if you're not feeling well or tired or just struggling to get all of that nutrition in. I would say that in my experience working with families, there's often a lot of anxiety and hesitation leading up to a G-tube placement, but I would say without fail, the reports that I hear back are that it's been a very positive and supportive experience, and that having that tube can take a lot of stress off of worrying about, am I getting enough? Am I going to get enough for the day? Am I getting enough fluids? All of these potential issues. So I'll move on to talk about some general recommendations. And the first thing that I want to say is that in my experience, the most important factor in implementing successful lifestyle changes is whether or not you take an interest in your own health. So for some people, we might be talking about quite minor adjustments to optimize your nutrition, but for some people, it might be more significant changes. And so like with any major lifestyle or behavior change, you really need to be bought in and signed on for that change to be successful in the long term. So what I find is that as your dietitian, I can make as many recommendations or suggestions as I want, but unless you really care about the impact that they're going to have on your health and really want to implement them, they're unlikely to be successful in the long term. And I also want to point out here that the nutrition advice that I can offer for people who are living with DMD is really no different from the nutrition advice that I would offer anyone looking to improve their healthy lifestyle. So these recommendations really can be fully embraced by all family members, which is nice. The one nutrient that I want to highlight off the top is fiber. So fiber helps to make you feel full, helps to keep you feeling satisfied, and can help to keep your body regular. Combined with adequate fluid, it can prevent constipation. You want to make sure that you're increasing your fiber intake gradually, and that as you do that, you're also increasing your fluid intake. One of the best ways to increase your fiber intake is just to increase your intake of vegetables and fruits, a dietitian's favorite message, I think. Another great strategy is to try and swap out processed foods for whole foods as much as possible. One example of that would be choosing a piece of fruit to eat over a glass of juice, where if you eat a piece of fruit, you're getting all of the fiber, and that's going to make you feel more satisfied than if you reach for a glass of juice where really you're just getting the sugar from that fruit rather than the fiber and the satisfying properties of that. If you do eat processed foods, it's a great idea to just do a simple label comparison. You don't necessarily have to read every ingredient or every nutrient on that nutrition panel, but if you're comparing two products, great idea to choose the one that has higher fiber and less sugar. I do want to note that these types of changes can be cost prohibitive. Fresh fruits and vegetables can be quite expensive. So as much as possible, we want to try to buy produce that's in season, or else choose frozen vegetables and fruits, which are equally nutritious alternatives. And this is where a dietitian would love to work with you about your specific situation to make some recommendations or substitutions that are going to work specifically for you. The next slide, I think, is going to just touch on fluids. So I really want to highlight water as being your best choice for fluids. Try to limit sugar-sweetened beverages and juice. And then also cow's milk or a fortified milk alternative can be a good way to make sure you're meeting your calcium goal. And in saying that, we'll move on to the next slide for some calcium and vitamin D. So I like to recommend optimizing calcium intake through food. So you can check with your dietitian, or else there are some online calculators like the one on the BC Dairy Foundation website, where you sort of plug in what a usual day of food intake looks like for you, and then it'll let you know if you're on track with your calcium goal or not. And in Canada, it's not possible to get enough vitamin D from the sun all year round. So we do want to make sure that we're taking a supplement specifically for vitamin D. And you can talk to your dietitian or your doctor about how much you should be taking. The next slide is just going to be a quick word about trying to moderate salt intake, especially if you're on steroids. And I just want to say the majority of the sodium that we eat doesn't actually come from the salt that we add during cooking or the salt that we might sprinkle on at the table. It's really more in the processed foods that we eat. So trying to choose fresh or frozen foods over canned where you can be helpful. Or if you are using canned foods like canned vegetables or canned beans, just give them a really good rinse before you use them. And again, a quick label comparison, or just looking for products that say lower sodium or no added salt, or just comparing between two to choose the one that's lower in sodium. And then I just wanted to say also, sometimes all we need is a little inspiration. And so what I thought might be a fun idea is I've started a little community board for family favorite recipes. And I started it off with one of my family's favorites, which is a lentil mushroom bolognese. But I thought maybe we could kind of swap some great recipes over the next couple of days so that we all have some new inspiration, new dishes to try. I think the last slide that I have is really just to say that a registered dietitian is one part of your team, and nutrition is one piece of the puzzle. But I really feel strongly that engaging with your healthcare team is the key to optimizing your healthy lifestyle. So as important as nutrition is, keeping moving is also really important. And this is where I would like to hand over to my wonderful physiotherapy colleague, Fatima, who I think Cindy's going to hop back on and introduce.
Thank you very much for that great presentation, Alex. And I especially love that you have put on the bulletin board, oh, whole bunch of stuff, the bulletin board to put on great recipes. So next in line is our physiotherapist, Fatima. Take it away, Fa.
Thank you, Cindy. Hello, everyone. It is my pleasure to have the opportunity to speak with you about healthy lifestyle from the point of view of physiotherapist. Because I'm a physiotherapist, I will talk to you about being physically active. But before that, I would like to talk very briefly about what physiotherapists can do to help you. As part of your multidisciplinary healthcare plan, you should see the physiotherapist in the neuromuscular clinic every 6 months for a complete evaluation. Physiotherapists can help assess range of motion of your joints and help minimize contractures or muscle tightness by getting you started with a regular daily stretching program. Physiotherapists will monitor muscle strength and function over time and prescribe exercise to maintain function. Physiotherapists, along with occupational therapists, and you will meet an amazing occupational therapist, Patricia, later on today. So they can recommend mobility devices, adapted seating, or adapted sports equipment to prolong or maintain mobility and independence. Physiotherapists can also help you recover after an injury or a fracture. Now, how often you see your physiotherapist in your community will depend on your age and your functional level, as well as whether they work with you at home, at school, or in a clinic. It is important to have the physiotherapist from your neuromuscular clinic and your community physiotherapist connected, so your exercise program and your equipment needs are always up to date. Next slide, please. To live a healthy lifestyle, we all need, among other things, good sleep, good nutrition, as it was well presented by our awesome dietitian, Alex. We need to have friends, and we need to be physically active. You probably already have your daily exercise program that your physiotherapist has helped you set up. These exercises, such as stretching and strengthening exercise, form the foundation for your best form and functional level. Your daily exercise routine will help you keep walking for as long as possible. Manual stretch should be done every day, very slowly, very gently. Stretch the joint to the point, to the end of a comfortable range, then hold it for at least 20 seconds and repeat 5 times each joint. It is more effective and more easily established as part of a daily routine if it is started before your muscles get tight or before you get a contracture and before the stretching is painful. Another important way to maintain range of motion of your feet and prevent or manage contracture is to wear your foot splints overnight if you are ambulatory, if you're walking, or during the day if you are a wheelchair user. These foot splints are commonly known as ankle foot orthotics, or AFOs, not to be confused with UFOs. If it is possible for you to stand more than an hour at a time, it will help maintain range of motion of your joints, and it is very beneficial for your bone health, as it was very well explained by Dr. Metzger and Alex, how steroids can contribute to bone loss. Standing can be done with or without support. For instance, if you can't stand on your own, you can use a standing frame. because both ways allow you to do weight bearing, and that way helping with your bone health. Pay attention to your posture 24 hours a day. Yes, think about your best posture all the time while you are in your wheelchair or resting in bed or going to sleep. Good posture means fewer muscle tightness and fewer contractures. This is important whether you walk or you use a wheelchair most of the time. Your daily exercise program can be enhanced by your participation in regular, gentle aerobic activities such as adapted sports or other hobbies. Next slide, please. When you think about exercising, it is important to consider the following. All muscles have the potential for strengthening, given the best conditions such as eliminating gravity, using non-weight bearing, and avoiding eccentric work. Eccentric here is not about avoiding someone unconventional, such as my favorite aunt is eccentric, but it's about avoiding contraction of a muscle while it is lengthening under a load. For instance, you must avoid doing squats or doing stairs as exercise. Doing no exercises lead to muscle wasting. Use or lose it. Muscle activity is important in preventing disuse atrophy, maintaining strength, and maintaining flexibility. Too much exercise can cause muscle breakdown. People living with Duchenne must avoid over-exercising. It can lead to a condition called rhabdomyolysis. Rhabdomyolysis can happen with too much physical activity and dehydration, and can be life-threatening. If you feel muscle pain, or if you are very tired after exercising, or the day after exercising, you've worked too hard. If you feel rested after a good night's sleep, your exercise level is probably okay. So it's important that you check with your physiotherapist for an individual exercise plan that works best for you. Next slide, please. Physical activities then must be moderate in intensity, lower duration with regular rests. You must avoid overexertion and overwork weakness. Try to schedule frequent breaks throughout your exercise program or throughout any physical activity. Physical activities must be regular in frequency, so average 5 days a week. Avoid prolonged breaks and try to keep the same level of physical activity throughout the weekend, summer or winter break, or any prolonged break. Long periods of rest and immobility will cause loss of function. Physical activities must be gentle aerobic activities with low or no impact, such as swimming, cycling, or going for walks on flat surfaces. They must be performed with low resistance. So you must use lightweight if you are working out in the gym, for instance. Next slide, please. Why being physically active is so important? It helps you stay healthy, remain active, and be part of the community. When you live with Duchenne, you need to be physically active for the same reasons anyone else does. Physical activity goes hand in hand with developing a social network. You will meet new friends and develop a new peer support network. Friends will help you get motivated to participate in recreational activities such as team sports or hobbies. Physical activities help increase your self-esteem and your mood. They promote the release of feel-good brain chemicals such as endorphins and serotonin. Endorphins can help relieve pain and stress, and serotonin can improve your appetite and your sleep. Living a healthy lifestyle means the same thing for all of us, getting and staying in shape so we can lead full and active lives. Active people with or without disabilities generally live longer and are at less risk for serious health problems because physical activity can help manage chronic conditions and its complications. Next slide, please. For people with Duchenne, some exercises are more beneficial than others. Team sports like soccer have many benefits. People with Duchenne benefit from playing sports just like anyone else. The self-esteem, sense of belonging, and accomplishment that a person receives from being involved in sports benefits everyone. Some of the physiological benefits include improving cardiovascular health, muscular endurance, flexibility, coordination, bone health. Some of the psychological benefits include improving self-concept, self-esteem, being able to relate to other people, improving friendships, as well as improving overall quality of life. Next slide, please. Other beneficial exercises include non-weight or low weight bearing activities such as swimming. This helps keep your joints flexible, provides aerobic conditioning, and improves respiratory function without causing additional stress to the body. Please note that a cardiac evaluation is recommended before beginning any form of hydrotherapy. Cycling, just like swimming, it helps keep your joints flexible and your muscles moving, as well as it improves respiratory function. It is also a gentle aerobic activity when you are riding on a flat ground or you are using a powered assist bike on hills, for instance. It also works on coordination and balance and physical endurance. Horseback riding allows you to stretch and work muscles that you would normally be unable to use on land. And it also works on core muscle strength. Next slide, please. So how to get started? Remember that there is no one-size-fits-all exercise prescription for people with Duchenne. One person might be climbing mountains, while other needs assistance to climbing to bed. The degree to which a person can be active depends on a variety of things. Next slide, please. Focus on what you like to do, because exercise, it isn't an easy thing to keep doing. There are a lot of different physical activities for you to choose from. If you would like to try a new activity or sport, you could meet with a recreational therapist who is the expert in this area. They can help you discover what activities you would like to explore, as well as they can recommend adapted equipment that will help you be successful. You will hear a lot more about this directly from our recreational therapist, Sherry, later on today. Next slide, please. So staying active is a lifelong commitment. You will be more likely to stick with an exercise routine if it suits your abilities and your interests. Find opportunities to increase regular physical activity in ways that meet your needs and abilities. You start slowly based on your abilities and fitness level. For instance, be active for a few minutes at a time. You slowly increase activity over several days if necessary. Include aerobic physical activities that make you breathe harder and your heart beat faster. And most aerobic physical activities may need to be modified, adapted, or may need additional assistance or equipment so you can be successful. Next slide, please. Engage in the amount of, and types of physical activities that are right for you. Remember to be wise about spending your energy. Even if you walk for the most part of your day, you could still use a power mobility such as a power wheelchair as needed to conserve energy. You may use your power wheelchair to get to your destination, And then you will be rested enough to participate fully in the activity you chose to. Next slide, please. Use the buddy system. Knowing someone is waiting for you at yoga class can be a powerful incentive. Next slide, please. Avoid being sedentary. Some physical activities is better than none. In summary, many complications that affect function and mobility in Duchenne are predictable. Some are preventable, and all are manageable. There is need for lifelong treatment. It is important to share your goals from your neuromuscular clinic with your community support team. Perform your key exercises and stretching as often as possible. Make them part of your everyday life. Your participation in physical activity beyond physiotherapy sessions can enhance the quality of your life. Next slide, please. Here are some ideas of adapted physical activities. It's mostly in Western Canada. It may inspire you to get started or to keep up with the physical activities that you are already doing. You might want to take a screenshot if you like to check these websites later on. I tried to add to the messages in the web, the WOVA, but I wasn't very successful. But I can always get that to you at another time as well. Next slide, please. Here are just some references that I used for the content of this presentation. Thank you very much for the opportunity. Back to you, Cindy.
Thank you very much for that very informative talk, Fa. All right, so Rochelle, what's happening next?
Perfect. So what we're going to do is very similarly to those that were on the last keynote session, is that Fatima and Alex, we're going to ask you both to go into your coffee break sessions now. And for those that would like to have one-on-one conversation with these two specialists, you can go directly into those coffee break rooms and have that conversation. I know that there's a couple of questions that were posted in today's Q&A specifically for Fatima. So those individuals, I would highly encourage you to go into her coffee break and have those questions and dialogue with her. We are going to start the next keynote session right after this one. Again, it will be recorded, so you can still go into your coffee breaks, have a nice conversation, and then you can jump into the next keynote session or watch it at a later time, just so we respect everyone's time and we keep up with today's schedule. So with Fatima in mind, I think everyone might need to take a stand up and stretch, and we'll see you online in the next keynote session in just a moment. Thank you.